Well, it is 11:30. Um, and as Sherry said, we will record this so others can catch up. So I think we should just go ahead and proceed. Thank you all for taking a few minutes, an hour of your day to be with us. Thank you especially to Representative Cory Chun for stepping in last minute for Senator Sharon Moriwaki. Um, Sherry kindly provided me with your bio, so I'm going to just read a little bit of it to kind of help everybody understand who you are and what you do. Representative Cory Chun represents portions of Pearl City Waipahu Crestview, and he serves as the House convener, the legislature of Kūpuna-Caucus, a group of over 200 members. Before serving in the legislature, he was a longtime advocate for cancer research and continues to maintain strong partnerships with the Alzheimer's Association and the American Cancer Society. He has championed key legislation benefiting older adults, including the Silver Alert program that passed last year and a provisional licensure for mental health professionals. So that's just a portion of his bio. But thank you again for doing this for us. And I will turn it over to you.
All right, thank you, Laurie. Hey everyone, thanks for having me. So, just wanted to share. I was asked to share some of the highlights from this past legislative session regarding Kupuna issues. So, I am one of the co-conveners of the Kūpuna Caucus, along with Representative Greg Takayama in the House and Senator Sharon Moriwaki in the Senate. And so, just some background on the Legislative Kūpuna Caucus. So, I don't know exactly when it was started, but I've been told that it's one of the oldest caucuses in existence. So we have sort of like a history of just being there and involving a lot of community stakeholders. And so these are some of the key cool things about, I think, the Kūpuna Caucus is that one is that we're the only caucus that meets all year round. So even though we're not in session, we'll still have meetings, and they're every first Friday at 2 p.m. They're all recorded and all available on YouTube. So even if you can't make the meeting, you can always watch to see what happens. And we try to have people come on to just either update what's been going on in the Kūpuna space, or also bring in government agencies to talk about maybe some changes that are on the horizon that people should know about. So we try to make it very informative for people so that they can get kind of the up-to-date information on what's going on with state government and the agencies that directly affect seniors. So this is sort of the information on how to join. And yeah, we're on YouTube, so you just type in Kūpuna Caucus in the search and it should come up, and you can actually subscribe and view our meetings there. I want to say we're one of the largest. I don't know the exact numbers, but there are 53 members, both House members and Senate members, that are official members of the Legislative Kūpuna Caucus. So it's 53 out of 76. It's a pretty high percentage of legislators. And every year, one of the features of a legislative caucus is that we get to introduce what is called a caucus package. So the House and Senate leadership allow each caucus to introduce 5 measures separate from what bill limits that legislators have. And so these are what comprises the Kūpuna Caucus package that gets introduced every year. The other key, really interesting fact about the Kūpuna Caucus legislative package is that all the priorities are picked by the community. So in every other caucus, there's the Environmental Legislative Caucus, there's the Women's Legislative Caucus, the Keiki Caucus. All of those other caucuses, the priorities are picked by the members, the legislative members of that caucus. We have the unique distinction of being the only caucus that allows the community to choose our priorities. So it really is a package representative of the Kūpuna community. And these ideas actually come from people who attend our meetings and come up with ideas. And we allow for anyone who's a member, a community member, to come in and vote on our priorities. And the top 5 are the ones that get introduced. So that's another key interesting fact about our caucus, that it makes us a little different than all the other caucuses. So you can go to the next slide. So I wanted to just touch on the 5. So we got 3 of our 5 Kūpuna caucus bills in our official package that passed. There were 2 others that did not. I did want to mention them because they were probably like because they made a top 5. That means, you know, they were really important issues for our community. One of them was a caregiver tax credit, which is something that's been in our package before. And then the other bill was one to create a expand the SNAP program to also target Kūpuna and our seniors. So those are the other 2. Kind of some of the issues with those bills that came up during the session was just the funding piece. So one of the big challenges and kind of the backdrop we were dealing with was the Lahaina fire settlement, which, you know, took a big chunk of what was kind of left over for everything else, and also just with the impending cuts from federal agencies that we were seeing. So those were some of the issues that kind of made you know, the tax credit make it a lot more challenging to pass this year, and also for the SNAP benefit. Just for some background, you know, if you saw in the news, our SNAP program was kind of going through some challenges. We were actually fined by the federal government for not processing SNAP benefits quickly enough. So one of the issues there was, before we could expand our SNAP program, we had to just take care of what we already had and make sure that the benefits were getting out. So the decision was sort of made to kind of table it until we could actually fix our SNAP program and make sure that the current benefits could be getting out before we started looking at new benefits. Because just tacking on a new program for something that was just going to cause more problems, you know, just wasn't really a good idea at the time. So we've put in place some efforts to actually beef up the SNAP program and also modernize it, and to make sure that those folks who are getting those benefits on time. So the 3 Kūpuna caucus bills that did pass, the other 3, so one of them was related to Kūpuna housing. If you go to the next. Oh, went too far. Okay. Yeah, so the first one was HB 703 relating to Kūpuna housing. And so this was a program that was established in 2023. It's a state supplemental program, which what it does is provides like a rent supplement. So an extra $250 just so someone could get that extra help to pay rent. And so normally what we do is we set up pilot programs. And the reason why that's sort of like how we start to do things is because we don't know if it's going to be successful, or not just successful, but if the money is actually going to reach the people and help the people that need to be helped. So we started it off as a pilot program, and then realized that, you know, it was really needed, and there was, you know, there wasn't a financial burden on it because the money was still there. The fund wasn't depleted. So all we really needed to do was extend the program. And so that's what we did for another 2 years. To just keep it going, because the other impending issue that we were kind of cognizant of is possible reductions to Section 8 and HUD funding that might come down from the federal government this year. And with housing being such a critical issue, and knowing that our seniors are on fixed incomes, any type of reduction from the federal side would directly affect, our folks who are trying to just stay in their homes. So this was a measure that was a priority because we want to make sure that that funding stream and that support could keep going. Oh, this is a good reminder. So yes, so the program is run by Catholic Charities. They administer the program for the state. And so if you know of anyone who's interested or maybe is having a tough time paying their rent, please reach out. And I have some information on the last slide about how you can reach out to this program. Well, and we have their phone number right there. Okay, so the next bill that we were really excited about too was House Bill 705. So we kind of dubbed it the Medi project. And really what the program is intended to do is to make sure that people who are eligible for Medicare and Medicaid benefits are receiving them. And so that's kind of a big key because a lot of times we've seen that with long-term care insurance and other things where people purchase it and they forget about it. And then when it comes time for them to need it, they forgot they even own it and they don't take advantage of it and they paid all this money into the system and then it just kind of goes to waste. So this program was established to make sure that, some people who come in and they apply for maybe a certain benefit, they don't realize that they also might be eligible for all these other benefits. And so really what this program is intended to do is to make sure that people who are eligible for all the different types of benefits across the spectrum, not just food, but maybe housing, can make sure that they're eligible and get them enrolled so they can take advantage of these benefits. So yeah, just going along, it's supposedly established again as a one-year pilot project, and it's really kind of focused to go into certain communities because we do know, just based on household income and need, there are certain communities that, for if it's a language access issue or just, some folks just, don't trust the government. And so, they might not feel comfortable reaching out. So sometimes we have to reach out to them. So what the program is really designed to do is to go into these communities and work with community health centers and also community organizations to kind of get the word out, to help spread the word, just so that we can get people enrolled in these programs and take advantage of the benefits that we're trying to provide. And then the last one was a priority that came over from last session, and it was something that we didn't weren't able to take care of last year, but we wanted to take care of this year. And it really was increasing the funding for Medicaid for in-home services. So that is something that's, we've kind of fallen behind on. And with our population, we do know that, it's always better to, if someone can, to age in place at home. And that's always the desire. But with the payment levels for Medicaid, it just wasn't matching up. And it was just really hard to attract and to build up those services where people want to do that. And so this year, one of our priorities was to make sure that we got the funding in so that it would be stabilized and that it can continue to grow and we can continue to provide the services. So Senate Bill 298 was a bill that it was introduced to do just that. So just some background, there are kind of two ways to fund things that go. So you can either do it by a bill, which this one did. It was a appropriation bill, or the money could just be placed in the state budget. And so in this case, when the budget bill is being decided at the end of session, the funding for this was placed into that budget bill. So the bill wasn't needed. Some other examples of why maybe you would need a bill is because there's policy attached to it. But in cases where it's just a straight appropriation and all the bill says is, the legislature appropriates X amount of dollars into for a certain purpose, then it can be just done through the budget. So this is one where if you look it up, it looks like the bill didn't pass, but in essence, what happened was the money got placed into the state budget. And so because of that, the bill didn't pass, but the money is there. And we did fund the Medicaid increases for the in-home services. So I think those three were kind of big wins because just the need is great, and when it comes down to it is we're always competing with all these other needs, education, transportation, right? All of these other things that people want. So um, just advocating and trying to make sure that we can keep these programs going and even increase funding for certain programs to help our Kupuna is really key. Go to the next one. So I mentioned there are 5 bills in our package, and it's sort of a limit by our leadership in the House that each caucus can only introduce 5 bills in their package. That doesn't mean that the 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 ideas. So we had 13 proposals this year to vote on, and only the top 5 got in. So the other 6, wait, 5. Well, the other ones, um, we're just as worthy. And so what we usually do in that case is we have other people just introduce them, not a part of the Kūpuna Caucus package, but just as individual bills. So one of them was fall prevention, funding for our Department of Health's fall prevention program, which was a priority last session and got funded. Didn't make it into the Kūpuna Caucus package this year, so it was introduced by Representative Mike Lee as a standalone bill. So this is a program that it's was placed into the Department of Health, and really what it does is just try to educate folks on fall prevention and just ways to make sure that people are safe in their homes. So what we want to see eventually happen though is because every year we've been introducing bills or getting this money placed into the budget, and we have to ask for it every year. What we're in talks about this year is that we should just somehow wrap it into the base budget so that we don't have to keep asking for it, because it's really not a lot of money. It's $100,000 for the campaign. But the folks who are advocating for this, they realize how important it is, and we kind of realize how important it is too, because without the funding, without the continuous education campaign that goes on, there are going to be those instances where people fall and are seriously injured. And this is something in my mind, that it's not a lot of money, but if we can keep it going just to make sure that these campaigns can continue on, is really important. So this is one of the ones. It did pass. It was not part of the Kūpuna Caucus package, but directly related to Kūpuna and our seniors. Go to the next slide. Oh, this is just a picture. So here's some of the members of the Kūpuna Caucus. So every year we hold a press conference that just pretty much goes over our 5 priority bills for the upcoming legislative session. So yeah, there's within that photo, besides some senators and representatives, also ARP and the Executive Office on Aging, who are the key partners in a lot of the policy issues that we take on. So this one was another measure that was put up as an idea for the Kūpuna caucus package. It did not make the top 5, but it was a priority for the Alzheimer's disease. So I introduced this separately on behalf of the Alzheimer's Association. And what this bill does is it kind of standardizes a cognitive assessment to be part of an annual wellness visit for Medicare patients. So, what we've seen is that a lot of referrals come from these annual wellness visits, and we just want to make sure that everyone's getting one if they're of a certain age, and because it's just part of the visit. And what we're trying to do is also gather data and just to collect assessments on how these tests are being done, because we do know, similar to like a lot of chronic diseases, early detection is so important. And so if these very simple cognitive assessments can lead to an early detection of Alzheimer's or dementia, it just makes sense, right? Because all of the new treatments that are coming online are much more effective in the earlier onsets. And a lot of times, I see this a lot with my work in the cancer space, but the same thing there too is like there's a lot of cutting edge cancer treatments, but the later stages you are in the disease, the less effective they are. So this is one of those things to try to address that issue, because it really is an issue of early detection. And so, that was, I think, a really good start. And then I think once we gather the data over the next year, we can start to see where the pockets are, and maybe go back and reassess. Okay, we can go to the next slide. So the other one that passed too, that was something that Senator Donna Mercado Kim introduced, was an Alzheimer's disease and dementia training for the University of Hawaii Johnny Burns School of Medicine. So this is direct funding to the school so that they can focus on dementia training for their residents and students who are going to be our potential doctors. Because we kind of realized that, it should be part of general practice or general practitioners. And I know, there's gerontologists in the gerontological field, they focus on this, and this is one of their things. But we also wanted to make sure that all of our doctors who are being trained in Hawaii also have some kind of understanding and training on spotting dementia and Alzheimer's. And so this was one of our attempts to try to make sure that we can kind of build that sort of knowledge base within our medical professionals. And it kind of goes along with a lot of the programs that we were offering to make sure that our doctors who are trained in Hawaii stay here. So if you heard from the past couple of years, there's been a lot of loan repayment programs for doctors who graduate or have their graduate from here and at least commit to work in the state for a certain amount of years. There's a program to expand residency options, because one of the things we saw is that doctors who do the residency here are more likely to stay here. And so this is another bill that tries to kind of include dementia into that whole process, where we're trying to train more doctors. But now that we're doing that, we can also incorporate a program for dementia and Alzheimer's. And this is just a photo of Alzheimer's Advocacy Day. So, our community partners are really great at advocating for these issues. So every year, ARP does one, Alzheimer's Association does one. council, there's older Americans, trying to think of other groups. But yeah, they always come down and are very supportive. And really, we can't do this work without you folks and the community. And that's why we've kind of designed the Kūpuna Caucus the way it is, because it's not our priorities, it's the community's priorities. And it just makes it a lot easier to get that support and get that buy-in from our colleagues, which is really key to make sure that these issues stay top of mind, so that when it comes down to making choices and final decisions, that some of these are pushed up to the top and we do get the support we need to pass them in the final stages. And then yeah, the priorities, they're just supporting those two. So the other two things that passed this session were two resolutions. Really, this was an idea by Senator Brandon Elefante, just to make sure that when it comes to thinking about emergency preparedness, especially since what happened in Lahaina, but not just with wildfires, but just with any type of natural disaster. So be a hurricane, or even just sometimes now we're having floods, flash floods, just because of the inconsistent rainfall. And could be an earthquake. You never know. But really, what it's trying to kind of continue the development of a emergency preparedness program geared towards Kūpuna, because one of the things that came out of the wildfire, I guess we had a wildfire mitigation plan. There was no mention of Kūpuna in that plan. And so this is something that we thought was really lacking, because we do know that for some of our Kūpuna, you can't just have a regular evacuation or emergency preparedness plan, because there are a lot of other factors. One is like mobility, having the right medications when you go to a shelter, and all these other issues that were not addressed in our wildfire prevention plan. So really what this resolution is attempting to do is just trying to continue coordination between our Hawaii Emergency Management Agency and community organizations like ARP, to make sure that if there are folks out there who may need extra time in evacuation plans, or other considerations, that those are taken into account. And when they put together a plan with either caregivers or whatever help they need, that it's understood what exactly their needs are when leaving wherever they are and going to a shelter or another location. Because in some instances, you only have minutes to leave wherever you are to get to safety. And like we've seen in other past disasters, every minute counts. So this is sort of a way to try to get those initiatives out there and to make sure that the folks that need the help can get the help. Okay, go to the next one. So all of these bills that I've kind of mentioned before passed the legislature. The only one that is technically done would be the in-home Medicaid funding, because the governor did approve the budget bill. And so right now that's the only one. So the other bills right now are at the governor's desk. So I just want to go over the next kind of steps, since the legislature adjourned already. So June 24th, the governor is required to submit a list of bills that he intends to veto. And this is part of the 45-day limit, time limit that he has. So once the legislature adjourns, the governor has 45 days to either veto, sign it into law, or to just let it go, not sign it and let it lapse into law, which means on the 46th day after, if he hasn't signed it or vetoed it, then it just becomes law. But in the Constitution, we put in this 10-day requirement so that and this comes out every year where the governor will send a list of bills that he's intending to veto. It doesn't necessarily mean he's going to veto them, but if it's not on the list, he or she cannot then veto it, before the 45-day limit. So it's sort of like a notice to the legislature in case we want to plan a special session to override the veto. So then July 9th, that's the 45-day timeline I was mentioning before. So the governor can either veto or approve before then. So one of the key things now is that for the governor, he likes to do bill signing ceremonies. And so on behalf of the Kūpuna caucus, we've actually asked for bill signings for these measures. So if you're interested, we could probably give you that information. It's what usually happens is the governor kind of schedules these around his schedule. So sometimes you don't get a lot of notice, but it's kind of nice to be there with all the advocates and to see it happen in real time when the governor actually approves it. So it's a kind of a worthwhile experience to be there, especially for the folks who've worked on the bills and took the time out to advocate for it during the session. And I think I have one more slide. So this is just more information, again, about our Kūpuna Caucus meetings, and then some information about the Catholic Charities Kūpuna Housing Program, and then my contact information. And that's, I guess, the end of my presentation. So I'm open to any questions anybody has on anything.
Thank you so much.
Representative Cory, for the dementia training.
Yes.
So how do they get permanent funding then, JABSOM? Because is it 2-year funding for that dementia training?
Yes.
Well, I guess there's different ways to come back every couple of years, but that's a hard road, right? To come back.
It is, and that's sort of like what I was mentioning with the fall prevention too, right? That we have to come in every year and ask for it, and so that's one of the things I was talking with, now the former finance chair, about just somehow getting that as just recurring funding, because it's not a lot of money, and when we've introduced it, they've never not approved it, because when it was in the package last year, I mean, I've only been doing this for 2 sessions, but the last 2 sessions, the legislature has funded the fall prevention program. So it kind of makes sense just to make it as part of the base budget.
And also JABSOM JABSOM has to take some ownership too,
Yes, and that's the thing too. You want to make sure that the program is successful and we're not just being good stewards of tax dollars. So it's also dependent on how well the agency does to implement the programs. And so that's part of the issue too, right? Sometimes we provide money to do something that's very important and it doesn't get done, or the outcomes aren't what we thought it would be, and so it kind of make the decision that we should go in another direction or redirect the money somewhere else. So.
Okay, thank you.
Yep.
May I ask, with regard to the Medicaid in-home services
Yes.
funding, is that, I am assuming, within the long-term care program? Medicaid's long-term care program?
Yes. Well, yeah, it's part of the Department of Human Services, for their reimbursement. So it just widens the pool and makes it bigger.
Is there
funds.
a dollar figure attached to this in terms of for Medicaid recipients what this means?
I don't
I
know
mean,
the exact breakdown per dollar. I got to look at the exact amount we put in.
I know that for some people, they may get enough to pay for a caregiver for 4 hours once or twice a week, but just wondering what the impact of this is.
So I think you're looking at the rates. Is that what?
I'm in the bill. I think it's well, the total amount is 250,000.
I think she's talking about the per person potential reimbursement rate. I don't know if we have that information on.
Hmm.
I don't think it would be that built.
Yeah, I don't see it within the actual bill language, but we can find that out and get that information to you.
That would be helpful. Thank you.
Representative Cory, for the in-home services, one of the limiting, well, maybe one of the biggest limiting factors is wages, right? For these home and community services employees, right? I mean,
Yeah.
it's hard work, and especially for the rural counties, right? The big island, you can be on the road a long time, right? Driving. I guess my question is was that one of the goals for increasing the funding to increase wages?
Yes.
Okay.
Yeah. So the reimbursement rate for the services, similar to what we did last year with the foster care homes.
Mm-hmm.
So that was another issue where the Medicaid reimbursement for foster care homes wasn't raised for 16 years. Last year we put in money to increase the reimbursement rate for foster care homes, and then this year, and it's never going to be enough. So we put in a modest increase, but then the chairs of human services in both the House and Senate wanted to prioritize the in-home services this year. So that's why the focus was on the Medicaid reimbursement for in-home services.
Thank you.
Yep.
I am curious to know if there's been, what we're doing about the possibility of losing Medicaid. And is there anything people can do or like right now, isn't it being voted on or about to be voted on the federal level? And do we know how that's going to impact us?
Yes. Yeah, we really don't know. I mean, we've been in contact with our congressional delegation. I know they've come and briefed us about some of the things that were possibly coming down, but yeah, until those decisions are made in Congress, it's kind of hard to tell. But we do know certain programs, it's just going to be really hard to replace, for the state to replace. So, for example, even for the Kūpuna housing program, Section 8, right? For folks who are in Section 8, the Section 8 program covers the rent based on a percentage. The state supplement program that we have right now is a flat $250. So while the Section 8 program could cover up to I think $1,500 off of rent, if that went away, the $250 is not going to be able to keep people in their homes, fortunately. And there's just not enough money. I mean, one of the things that the folks who've been around, especially in state government, said, the biggest difference between the federal government and the state government and us is that the federal government can print money we can't print our own money. So that's one of the big challenges, right? And and especially when when we're very cognizant of the cost of living and doing anything to, put the burden on everybody, whether it be taxes or some other type of fees, it's going to be really challenging. And so until we kind of know so one of the things we did do is we put away $200 million, which is not chump change, but yet it won't be enough to fill up if the federal government pulls out everything. But that was set aside specifically this session so that we could come into special session after we know what the impacts will be and try to plug whatever holes we can. And we kind of are assuming that it's not going to be enough, but at least we're gonna try what we can do to just make sure that the most vulnerable don't fall through the cracks and are really hurt.
So that's something we'll have to stay tuned about, but thank you for being
Yes.
forward thinking, putting that money aside. Even though it is what it is, it's better than nothing, obviously.
Yeah.
Do we have any other questions? And I don't see anything in the chat. We really appreciate you stepping in and doing this. This is a very interesting discussion, hearing about what passed and what it all means. Some of these things we'll have to wait and see, I suppose. But it really gives us a heads up on what's coming. For that, we really thank you.
One more thing, Representative Cory. So to a large degree, any federal reductions, including Medicaid, will boldly frame next year's legislative session, won't it?
Yes.
Yeah. I mean, looking ahead, I know we're just dealing with the vagary, right, of reduction, but nevertheless, it will take a lot of the oxygen out of the air, right?
Yeah, and we should know more. So the other thing too is we're on 2 different fiscal calendars. So the state of Hawaii runs on a fiscal calendar from July 1st to June 30th. So that's our fiscal year. The federal government runs on a fiscal year starting October 1st and ending September 30th. So a lot of times, and this is part of the issue, is that we've created our budget and we had to pass a budget, but because the federal government's budget doesn't run till September 30th, we probably won't know. I mean, they'll still have to decide on their budget now, but how it gets implemented October 1st, that's going to be the big key. So whatever budget they approve and then how it gets funded of October 1st, that's going to be the next, yes.
Right. The timing of expense
timing.
is not aligned with the timing of the income coming in.
Yeah. So any changes probably won't take effect till October 1st. So we may see the changes happen, but because the federal fiscal calendar won't start till October 1st, we'll have between whenever that decision is made at October 1st to kind of make the adjustments or kind of prepare.
Cool. Thank you.
Yep.
Yes, I echo. Thank you very much for being here, for making this presentation. Just a quick reminder to everyone that we have a important conference coming up, September 11 and 12, our biennial conference, and we are working hard to get that ready to present to you all. So please keep in touch with us with our newsletters as we provide more information. We've got some national speakers on board, and we think it'll be very informative. thank you all for taking the time, and I think we will close this meeting, adjourn it, and we will see you next time. Thank you.
Thank you, Lori. Thank you, Representative Cory.
Yay.